So thank you everyone for coming here. We have a bunch of people to give remarks. First, we have our wonderful county executive who allows the health department to do the work that we do, trusts us on a day-by-day basis, and without his support and the support of county government and all our partners, we could not do the things that we do. And Dr. Senator Lamb just walked in. Thank you for joining us. So I'll turn this over to Dr. Ball.
Thank you, Dr. Rossman, and the entire health department for being fantastic partners, not only throughout the pandemic, but in ensuring that Howard County is the example for mental and physical health throughout our state, our nation, and our world. As we continue on this road to recovery, we are a more resilient community. We learned how we can maximize technology and innovation to ensure all residents are healthy and thriving. We also know that the pandemic underscored several needs, specifically around the well-being of our children. Together, our government, our schools, and health leadership did everything to prevent and address learning loss. Even though our children are physically back in school, any lost day for any reason is a hardship. Anytime a child is sick from school, it's a hardship on the child and the family. This is especially true for parents, guardians, and caretakers who may be working 2 or more jobs just to make ends meet. Today, we're here to celebrate the expansion of school-based wellness services and telemedicine services. Together, we're eliminating barriers for our children, our families, and our communities. In this year's school budget, we added 7 health assistants, 2 nurses, and 1 additional health specialist who will be integral in this expansion. These staff are critical and will work with partners such as our Howard County General Hospital and Columbia Medical Practice to address health needs and also health disparities. We want to be able to treat illness and prevent chronic diseases such as diabetes from occurring. By investing in our children's health, we can change the trajectory of their lives for the better so that they can stay active and engaged in school, work, play, and grow to be their very best selves. I want to again thank Dr. Rossman and her entire team, as she is representative of health departments all around. I want to thank the Maryland Department of Health and, of course, my partner in schools, Dr. Michael Martirano, for committing to our students' health, their success, and building the very best, brightest future for all. Thank you.
Thank you, Dr. Ball. Indeed, this is a teamwork. Partnerships are required. So why are we here? Healthy students are better learners. In-person learning is important to maximize student achievement. While there are many factors affecting students' in-person attendance, illness causes a substantial proportion of absences in children. Reducing absences from school is an important strategy for promoting long-term academic success and well-being. In addition to school absences, children's illnesses cause parents to miss work either because they have to take a child to the doctor or they need to stay home or both. Increasing children's access to health care reduces the frequency and duration of illnesses and time away from school. By recognizing the importance of providing students with access to health care in schools, Howard County opened the first school-based wellness center in 2013 at Bowman Bridge Elementary School. Not long after, in 2014, the county launched the first school-based telemedicine program in 5 Title X elementary schools in the county. These schools receive federal funding as many as 40% of enrolled children come from low-income families, many of whom are or underinsured. These are often the families most adversely affected by missed school and work days and have family members working multiple jobs. Word of mouth and proof of concept has allowed the School-Based Wellness Center program to expand to include now 11 elementary, middle, and high schools, 8 of which are telemedicine sites. There are over 3,000 children currently enrolled, with more students enrolling every day. Working with our pediatric partners like Columbia Medical Practice and Howard County General, providers are able to virtually examine sick children using specially crafted medical instruments at each telemedicine site. And some of these providers are actually the medical home of where the student is taken care of ordinarily. Parents are encouraged to take part in the appointment, which can be done from their smartphone, tablet, or computer, as we will demonstrate shortly. Today, as a result of more than $800,000 provided by the Maryland Department of Health, we're now able to expand health services at our telemedicine schools to provide students with comprehensive preventative health care and chronic disease management. This is awesome. Services will include annual physicals, behavioral health screenings. We certainly learned the importance of mental health over the past few years, and health education. Managing chronic health conditions like attention deficit disorder, asthma, obesity can also be addressed in collaboration and coordination with the student, the parent, and the student's primary care provider. This critical MDH funding helps us support students to be more successful learners and to become healthier adults. So next, how do we make this happen? With the great partnership of Howard County Public Schools. And I'd like to introduce the superintendent, Dr. Michael Martirano.
Let's give Dr. Rossman a big round of applause. We can't give her enough. Good afternoon, or good morning, I should say. My philosophy as an educator is, in order to teach a child well, you must know a child well. And let's think about that for a moment. What we do know right now about our children is during the pandemic, and as we're coming and moving through the pandemic, is that our children were suffering in silence. And we have to lift that up as a community. Our outstanding county executive has just talked about that. Let's give our executive a round of applause as well, Dr. Ball. A wonderful partner as a superintendent. But what we do know about our children is that they regressed academically, and they regressed emotionally, and also their physical well-being. Let's acknowledge that as well, that their attention to routine visits to doctors was not as great. The attention to routine vaccinations that are a requirement for schools were not as great. And we're seeing that result right now in our schools. And so our effort as we move forward with the outstanding partnership with our health department and our community leaders is to expand our focus regarding our student wellness centers from 5 to 11, which will help us now provide service to over 3,000 young people. And Dr. Ball, when you were foreshadowing the expansion of what we have done with our health assistants and nurses, you can be sure that I'm developing my budget right now and that I will be asking for additional support this year to expand even further. And I see I'm getting some round of applause from our outstanding director of health in the school system, Carrie Wegeman, and her staff as well, who've done a tremendous job. But our goal is to provide additional supports for health in all of our schools. Because in order to teach a child well, you must know a child well. If a student is hungry and they're not fed, it interferes with academic achievement. If students are coming to school not vaccinated and they're not attending to the health levels at which they need, it interferes with the academic achievement and the wellness of the student. So all of the work that we're doing is focused regarding the betterment of our children. So the outstanding partnerships that we enjoy in Howard County with our executive, with our health department, with the federal level, Congressman Sarbanes, for your work as well. At the Maryland level, Dr. Lamb, you're an outstanding partner. We celebrate that because who wins when we do these kind of things are our children. And I'm very proud to serve as the superintendent of Howard County, where we focus on the betterment of our children every day. Thank you very much.
Thank you, Dr. Martirano. So who else allows to make this happen? Well, our great pediatricians at Columbia Medical Plan. And I'd like to introduce Dr. Scott Strahlman for a few remarks.
Hi, everyone. It's great to have you all here. My name is Scott Strahlman. I'm a pediatrician with the Columbia Medical Practice, and my department participates with the school-based telemedicine program. And it's fabulous. If one of our patients is sick and goes to the school nurse, they're participating with the program, they can connect through a video visit directly with one of us. We're their primary care providers. And actually, it's a billable service. We can bill for that visit. We have also volunteered to take care of any patients who don't have a doctor participating in the program, or who don't have insurance, or who don't have a pediatrician. And we provide that service free of charge because we don't want to put any financial hardship on the families. What's sad for me is that not too many pediatricians are participating in the program. If we could get a majority of pediatricians participating, if one of their patients got sick, they could provide a billable telemedicine visit and provide that continuity of care, which would be great. But also what's very sad is that a lot of these students, as has been mentioned, don't have insurance or don't have a pediatrician. So we feel great about being able to provide that service. And in a sense, we're helping to make a medical home for students who don't have one. Let me just briefly describe what I see as some of the values of this program. There are a lot of values. They're immeasurable. The biggest thing for me personally is this sense of collaboration. The health department is collaborating with the Department of Education, is participating with the medical community, and technology is what's brought it all together. You'll see some of that in our visit. We have access to digital otoscopes, digital stethoscopes, rapid testing for COVID and for strep. And what makes this unique and different from other telemedicine visits is that we have the hands-on component of the school nurse who can palpate lymph nodes, check for abdominal tenderness, do things that you can't do strictly through video. We have access to medications that can be distributed with physician authorization. So without a telemedicine visit, those medicines can't be administered. Minor illnesses can be treated, colds, rashes, and these kids, instead of being sent home, can be sent back to class, which is huge. Potentially, we can also follow up on chronic conditions, which we're very excited about. ADD, obesity, asthma. In addition to not taking the kid out of school, we have access to the teachers who can tell us how these kids are doing real time. So multiple benefits. I'm very proud of this program and everybody coming together. It gives us the ability to provide a medical home for those without one, and it gives us the ability to provide quality medical care, because it is quality medical care, to people who can't otherwise get it. And just briefly, I'm going to describe one example of a specific case, which happens multiple times. But there are children in the school system with asthma, pretty bad asthma. They don't have medication at school. They don't have any parental authorization to give medication. Without telemedicine, the school nurse would have to call 911. Ambulance would have to take the patient to the ER. Kid would miss school. Multiple resources would be used. With the help of telemedicine, we can examine the lungs. We can do a COVID test. We can administer a breathing treatment. And we can send the kid back to class instead of to the emergency room. So it's a very exciting program. Thank you for your support.
Thank you. Keep forgetting the mask thing, right? Thank you, Dr. Strahlman. Columbia Medical Plan and Scott were early adopters, and all back in 2013 or whenever we made the call, who's in, and they've been here. I also wanted to take a second to acknowledge our other healthcare providers who make this happen. Those are the people in the health department. Sharon Hobson, who runs the school-based wellness center program in the health department, and the Howard County Public School. Carrie Wegeman was mentioned, and I think there's other staff of Howard County Public Schools. Can you just stand and be acknowledged? 'Cause you're there. You're the boots on the ground. So thank you. At this time now, I want to introduce the congressional, I want to introduce Mr. Robert Boyd, who is the president of the School-Based Health Alliance. Sorry about that. Should have put on my glasses.
Thank you, Dr. Grossman. Political scientist Murray Edelman back in the 70s wrote that you're only a leader if people are following you. President Biden on the campaign trail talked about, well, otherwise you're just a guy out for a walk. John Sarbanes is our leader in the Congress. He's been with us for a long, long time. He has weathered nothing happening in Congress to the point where we now have federal appropriations to open more school-based health centers in Title I schools around the country. What you're doing here in Howard County is phenomenal. I bring you greetings from your colleagues all over the country that are envious of what you're doing, admiring of what you're doing, and learning from what you're doing. So please keep up the good work. Congressman Sarbanes, if you'd come up, I'd like to give you this Congressional Champions Award. It's funny. The congressman and I have met several times on video. This is actually our first time being together, so we wanted to take advantage of that opportunity to give you that congressional award. We thank you for your leadership.
Thank you very much. Well, I certainly appreciate the recognition, but I really view it as an opportunity to say right back at you and to all the health professionals in this room and across the country who are creatively figuring out how we can bring health services to our young people every single day. And I want to thank Robert Boyd for his leadership of the School-Based Health Alliance. We've worked in partnership with them for many, many years, and in the last few years we've been able to significantly plus up federal appropriations to go behind school-based health center initiatives all across the country. We do that in part with confidence that at the local level, like here in Howard County, we will see the kind of creativity that's being demonstrated here today, and I'm very much looking forward to the presentation that we're going to get. Let me take the opportunity to thank our Howard County Executive, Calvin Ball, for his leadership, because his leadership has met a high standard, an existing high standard in Howard County of how services are delivered. And he could have just kind of left it at that level, and most people would have thought, well, that's just fine. But that's not the way he thinks. He's always reaching for the next level. And the partnership you're hearing about today is just representative of work that he's doing across every arena, all agencies, to make sure the services to the residents here in Howard County are all that they can be. So thank you, County Executive Ball, for that. Dr. Rossman, thank you for your leadership. Again, if you think about those people that have been most on the front lines over the last few years, it's our health officers across the country at every single level, having to juggle a million things and doing it with a grace that's really amazing. So thank you for your leadership, and also to Dr. Martirano. Schools and sort of health services have been really under tremendous stress and pressure over the last few years, and I thank you for what you've done here in Howard County, which is really a model. In terms of building this connection between
health and education that we need to see, doing it both with physical health but also in terms of mental health services. And I want to give a shout out to my colleague at the state level, Dr. Lamb, for his leadership. Nobody ever knows whether to call him senator or doctor, so we just call him senator, doctor, or doctor, senator, or something like that. To Columbia Medical Practice, and we're looking forward again to the demonstration in a moment. Thank you for how you stepped into this partnership. And in particular, obviously you're in a position to connect with patients that you already have as part of your practice and may have private health coverage, but the fact that you're also stepping up to make sure that those who don't have those kind of resources are not being denied these services really, really important. So I'm excited to be here. I'm constantly working with my colleagues in the House to make sure that we are being as leading edge when it comes to marrying up health services to our young people. And the role that school-based health centers can play when you've got a captive audience there, or these coordinated telemedicine school-based health connections can play, that can be the difference. Not just to somebody's health, but to their education, because as was pointed out, if you can bring these services together, it means a student is not going to be taken out of class that day or sent home. They can get back into the classroom, if that makes sense under the circumstances, and they can continue with their education. So the more we approach education and health as really being linked together inextricably, and people in this room understand that, the better we're all going to be. So thank you again for the recognition, but it really is a chance for me to recognize the work that everybody in this room is doing, and health professionals across the country and school professionals across the country are doing every single day. Thank you all very much.